Talking about adherence to treatment, maybe we need more apps continuously monitoring patients. Dr. Shamji.
Yes, I think it's really important to engage the patient in this particular aspect, particularly because compliance is the key to success in terms of efficacy. So having apps that are intuitive, apps that are relevant and provide information straight to the physicians, easy for the physician to be in touch by having, for example, pop-up menus or something like that as a reminder. I think those would be the way. Integrated care pathways in this particular case is also thinking about multidisciplinary approach, and that would be, in a sense, thinking about adherence and how do we have infrastructure or platform that actually links between the physician and the patients, and if we have to create new infrastructure to actually achieve that, I think we should be very open about that.
Dr. Bousquet?
Well, I'm going to give you an example myself. As you know, I have allergic rhinitis. I have severe allergic rhinitis during the pollen season. I've written most guidelines, and I am not adherent.
Even you.
So, when I took 102 physicians allergists during the meeting in Munich, do you know how many physicians were adherent to treatment? Allergists.
0005?
Sorry?
0005?
Zero. So, it's not health literacy. It is human nature.
Yes.
Very few people are like you, congratulations. But it is human nature.
And will apps help?
No. Not like they are, because with the app, we have now 23,000 patients, as I told you. The adherence to treatment is 0.5%. So, people take that treatment, and you know what is the adherence to chemotherapy for leukemia? 17%. 1-7. So, it is human nature. So, allergists do not take the treatment where they know that it helps. How do you think that the patients are going to take the treatment if the doctor cannot do it? It's like, you know, in the old ages when the doctor was smoking and said to the patient, you should not smoke. So, we need to change things and possibly to come with new apps, bringing things which we are working on that now. I'm not sure that we're going to find it, but bringing some SMS or some insight when you have finished the app. Next year we are going to have a messaging after the app for each patient. So, but to me, adherence is something which is lost. You can't, if you even multiply by 10, 0.5%, it will still be 5%. So we need to find something else. We need to find possibly treatments which are very quickly effective, and the patient takes the treatment immediately as soon as they get symptoms, so that they are controlled. This could be a possibility if you have the right treatment. But you don't have it in Belgium, sorry to say that.
Dr. Bachert, is that the solution?
Well, you are talking about a specific drug which is combination of two of these antihistamines and topical steroids, and has the advantage that it works immediately, and it that way also brings in the steroid, the topical steroid, into the nose, and that has advantages, and my wife exactly uses
so
that.
You know.
And she's not adherent, but always if she has symptoms, she is using it.
But she's not adherent, and she's
no,
well.
She's well, because with that drug she's well. But I mean, it sounds now like, you know, all this immunotherapy cannot help because people are not adherent. We do know from registries in Germany where people were followed for their diagnosis, for their treatment, what they really got from the pharmacy, that in fact immunotherapy also in real life conditions is effective if you look for specific products. And you can even, with these real life registries, you can even make a difference between different products. And it's actually very nicely reflected what we say before. For some products we know that they are effective, and for others not. So it's not so hopeless, but it tells you that probably what we currently say, we need 3 years of immunotherapy and it has to be, you know, very regular distance. that is maybe a little bit asked too much to get, at least in some patients, maybe 30% of them, a real good effect, even if they miss the one or other tablet. So let's say it that way. And that's good news, actually. So it's not so hopeless, and I just wanted to say that. Adherence is the major thing, and I totally agree with that. And I would guess that, at least my personal idea is that to involve the doctor in the adherence of the patient more is a good thing. And that, again, can be by, did you take your medication? A short SMS, a short, where you get answer. But again, if the patient doesn't follow, doesn't answer to you, you're out of the game. It also needs the cooperation from the patient very much.
In this discussion, I heard we need more real-life evidence. We need more adherence. We maybe need more registry to know more about the patient. Mr. Bousquet, is it thinkable that we get an app that does all of that,
Yes.
all in one?
Absolutely. We're working on it, by the way. No, well, we have an app which it told me many things I didn't understand in allergy. So this app was fabulous because, for example, rhinitis and rhinoconjunctivitis are two different diseases, but no one has said that before. And it's coming from the app. And also, it told me what patients are doing. We're thinking to that, but now at the demonstration. So at the baseline, patients are not adherent. So how can we get them better adherent? Next year, we're going to send messages. And then we're going to include pollution and pollen data. And then we're going to try to go into more interactive ways, but this has ethical problems and privacy problems. So the app can bring something, but we need to think differently in order to bring something that we still do not know yet.